Honorable Minister of Health, State and Social Welfare Dr. Tunji Alausa has embarked on a crucial mission in Lagos State. He will be conducting a comprehensive assessment of the state's healthcare infrastructure, seeking ways to enhance its efficiency and performance. A cohort blog will be accompanying the minister on this enlightening journey, providing you with an in-depth look at this visit to prominent medical institutions, including the Nigerian Institute of Medical Research, Neuropsychiatric Hospital, Federal Medical Center, College of Medicine, Orthopedic Hospital, and more. Stay tuned as I Comfort Olayinka report for a cohort blog. In line with facilities assessments across Nigerian states, Dr. Tunji Alausa, Minister of State for Health and Social Welfare, visited the National Orthopedic Hospital Igbobi, Lagos. Once a chairman of its board of directors, got a warm reception by the management and staff.
How are you? Okay, Dr. You're back. I heard you went for some.
No, it was not the one. It's not the that went.
Oh, okay.
I attended the boss. Please step forward. Our new head of finance supported.
Replacement for Mrs. Yusuf.
Yes.
Replacement for Mrs. Osakide.
She's following acting for us.
You've learned the job for a long time. You know what you have to do. I'm glad to be back. It's not coming back from.
It's showing.
Before we start. Thank you, Mr. President. Introduce some of the people that have been with the minister on the familiarization with the health institutions, and then some of the head of the every representative. Okay, good to have you around. All right, and then we have a lot of our consultants here. Please, time will not permit me to start. At this point, I would like to hand over the mic to
The DG, Dr. M.F. Alimi, in his address, welcomed the minister back home, recalling all the achievements during his tenure as chair of the board of directors. He says the hospital has been building on those achievements.
Ladies and gentlemen, you are welcome, sir. Members of the union, those without whom you cannot succeed in office, I recognize you and I welcome you. All other members of staff here present, friends, supporters, members of the team that we have put this program together. I will not mention you by name, but you know yourself, you are well recognized. Ladies and gentlemen of the media, you are welcome to the National Orthopedic Hospital and you are recognized. The theme of my presentation regarding the state of this hospital is welcome hopes. So I am going to start with this. The National Orthopedic Hospital is a 78-year-old hospital. Anybody here can imagine the state of a 78-year-old man or woman. It has changed names from rehabilitation center to Royal Orthopedic Hospital currently to the National Orthopedic Hospital. It has changed leaders. Leadership has passed through 8 to 9 different persons. Like every other institution, our vision is to provide excellence in comprehensive healthcare and in training of those that will provide that comprehensive healthcare in qualitative, affordable, and specialized healthcare delivery, and serve as an advocacy center for the services that we render to the public. Now, what are the services that we render to the public? We render several orthopedic subspecialty services: spine orthopedic services, pediatric orthopedic services, orthopedic oncology services, complex stroke, arthroplasty, arthroscopy, and sports medicine, burns and plastic and reconstructive surgery. Right now, we have subspecialties. Microvascular surgery has come to stay. We are hoping that very soon hand surgery will join. Anesthesia, intensive care, and pain management services. We have robust physicians who provide cardiology and endocrinology services. Our radio diagnostic services is also not to be pushed aside. We have a thriving national health insurance service that provides primary health care with quite a number of staff and secondary orthopedic services to members of the public. We have psychologists and psychiatry services. We have a robust pathology unit. I have started physiotherapy because I'm going to come back there later. We have prosthetic and orthotics department. We have multiple services. Other services include occupational therapy, speech therapy, dietetics who serve our patients. These are all services that we provide in the hospital to provide a holistic management and care provision to teaching Nigerians. Now, our training services. Our training services include residency training program. Residency training program is over 40 years old in this institution. We are proud to say, right from the likes of Dr. Adipole, most of those who work here today are residents that pass through this robust institution. This institution is the grandmother of orthopedic services and orthopedic training in the whole of West Africa. Other training services that we render include, we have training schools. We have the College of Orthopedic Nursing, or College of Nursing Sciences down, and we have the Federal College of Orthopedic Technology that trains personnel in orthopedic cast technology and prosthetic and orthopedic services. We collaborate with foreign institutions to provide training. Here at the National Orthopedic Hospital Igbobi, Lagos, we have a SICOT training center. The SICOT is the International Society of Orthopedic Surgery and Traumatology. And we receive fellows, gentlemen and ladies who have completed their orthopedic training that come here for subspecialized training. We've received quite a number of them in the past few years. We are also an AO Spine Fellowship Training Center. In actual fact, we are currently the only one in West Africa. And that means that we can train international spine surgeons, international surgeons in spine subspecialty. Right now, we run our own local subspecialization training program in all our subspecialties. Now, these are images of some of our training that's going on. Structurally, the hospital has 15 wards. We have 9 operating suites. We actually have 473 beds, but we have 350 functional beds. Personnel, we have been granted the right of establishment of 1,553 personnel, but currently we have 1,440. That means that we have 313 personnel short and often in areas of core competence of the institution. We want to celebrate our achievements, and we are glad to have our past board chairman here, with whom we've achieved quite a lot of things over the past 4 years. During your tenure, sir, we started renovation of our wards. We started with White Bank Campus 1, 2, we did 5 and 6 and 3. We did the wards A, B, and D, the A and E, and we completed the modular better complex during your tenure, sir. The amenity ward, which is very much your area of pride. I tell people that when the board chairman comes for board meeting, he listens to everything you say. But when he gets to amenity, he sits up and he gives you scrutiny. You're welcome. With the Crestview Radiodiagnostic Center, I know your role in the existence of that place. I know the challenges that we went through. I know the role you play. But today is a signature in the hospital providing MRI services and CT services for our patients, such that our patients need not travel out of the hospital to get these services. And I dare say, in Lagos, I don't think there's any better MRI suite than the one we have in this institution. The electronic medical record. I want to state categorically that I'm not being sycophantic. But the electronic medical record at the National Orthopedic Hospital Igbobi was the idea of Dr. Alausa. And he followed it up tenaciously. It was an issue that, till it commenced, it was an issue that he wouldn't take kindly in the board, not knowing exactly why we have not commenced then. Today, we have commenced, and we have close to 30,000 on that medical record. Without boasting, sir, we have one of the most robust EMR services in this country. There is no patient that can enter our operating theater or exit, take our drugs, enter our ward or leave, enter our casualty, use our facilities or leave without being captured. All our patients are tracked by their minutes and by their movements. Some of the pictures I'm showing now are some of the achievements while he was in office. The wards that were repaired, the ICU that were repaired, and the commissioning that we did of the modular theater, the molecular lab, as well as the amenity ward. The amenity ward is still there, thriving, contributing reasonably to the IGR of this institution and to its image. It's contributing positively to the image of this institution. We thank you, sir. These are some of the images. While he was here, he initiated the renovation of the laundry. I must inform you, sir, that we have a modern laundry today, and it has been fully renovated, and it's part of the prosthetic and orthopedic services. It is the mother of P&O services in this country, but because of our challenge, we have not been able to take it to the level of a PSC program, which is what we are trying to do. Currently, we are in collaboration with the University of Medical Sciences in Ondo to get this done, and we are in serious discussion with Lagos State University of Science and Technology so that we can have a BSc conversion program for our graduates. As at date, that school has graduated 340 pupils who are major players in providing orthopedic and prosthetic services in the country. Here is a picture of someone matriculating and graduating students. The College of Nursing Sciences. At one of our meetings, the boardroom, or at several of our meetings, I would always tell the board chairman that nurses are leaving, nurses are leaving, nurses are leaving. So the board chairman, my Honorable Minister of State for Health, now said that, Dr. Alimi, why don't you establish a school to train your own nurses? And that was where we started from. We started working towards the establishment of the College of Nursing Science. He also said that, don't wait for my approval to do anything. Just keep going ahead and keep notifying me. Thank you very much. Today, the College of Nursing Sciences has been accredited by the Nursing and Midwifery Council, and we are waiting for the final accreditation by the National Board of Technical Education. As at a month ago, we conducted the entrance exam into the College of Nursing Sciences. We sold 1,060 forms, and we had 1,772 candidates that attended the exams. But our restriction currently is for 50 spaces, and we are hoping to get more. The first set, by God's grace, will resume before the year is over. We are hoping by the Honorable Minister of the State when he was board chairman, where are the blood separation units. Today, the National Orthopedic Hospital, we do blood separation. We can separate platelets, FFPs, concentrates, and all that from blood that we collect, such that in Lagos State today, only 3 institutions can do that. So we don't have to travel if our patients need platelet concentrates, FFPs for their management. Thank you, sir. The intensive care unit, which was commenced during his tenure, has also been completed, and today we are providing reasonable intensive care services to our patients. The ambucat, this is the ambucat. We have 2 ambulance cats, and their role is to convey patients from the wards. One conveys patients from the wards strictly to the theater. The other conveys patients from the casualty strictly to the wards and for x-rays and for CT scans. They are running fully. I would have shown them to you, but they are at the peak of their activities right now. But if they pass, I'm sure while you're here, you will see them. These are some of the pictures of some of the wards that we have rotated, that we have renovated. As an institution in Nigeria, we have a responsibility to give back. We have our challenges, but we do try to give back. Please, help me give a round of applause to the Burns Plastic and Reconstructive Unit. That department runs an annual burns work, conducting burns awareness around this area and in some schools around this place. We are hoping that they continue this lofty act. Oftentimes, that day in the hospital is a day that people are very happy to participate in these activities. We thank them, and we hope that they will still continue this activity. Recently, we started conducting the free school check, where we go to schools around our locality to assess children for deformities and some other challenges. This is championed by our head of Savicom, Dr. Wachuku. Dr. Wachuku, if you are here, I appreciate you and thank you. And so far, we have been able to treat quite a number of children. The first set of those that will be having surgeries will commence before the year is over. We had to stop because the schools were on holidays, because we have to pick them up from school to come and continue their management here. So I want you to help me thank the Honorable Minister of State for Health and Social Welfare for all he has done for us. But like Oliver Twist, please permit me to borrow this adage. This was given to me by one of my advisors yesterday. He says, a yellow come. So I put it there. Our local is our turn now, sir.
Dr. Alime used the opportunity to appeal to the Ministry of Health and Social Welfare to assist them with a histopathologist, remarking that in a world where cancer management is essential, a robust ethopathology, oxygen plants, burn centers are needed.
Our challenges for every institution that is this old, we are going to have challenges. We are very large in size. In terms of space, we are large. Many of our facilities are wards. Our youngest wards were commissioned by President Buhari when he was General Buhari. We have wards that are over 60 years old. We have areas in the hospital that are close to 80 years old. We have staff quarters that are aging, and we are struggling to maintain them. Oxygen plant. Our oxygen plant has been down for 4 weeks. I know most members of the hospital are not aware. The cost of providing oxygen to the hospital on a weekly basis is between 1 million naira and 1.1 million naira. But the cost of repairing it, as at 4 weeks ago, was about 40 million naira. 40 million naira is in the midst of the things that we need to do. If we remove it from our IGR, it will shake the wallet significantly. So we are appealing to the Honorable Minister of State for Health and Social Welfare to help us take a very urgent look at it. Because if we wait for 40 weeks, we would have spent the 40 million naira and we still don't have a new oxygen plant. Our bond center. We talked about the bonds, reconstructive and plastic department conducting bond works. But our bond center is an old bond center. It needs to be brought to the state-of-the-art modern bonds management provision. In Lagos State, once burns is beyond 15%, they are shipping into Igbobi. Lagos State Hospital will not take those patients. So we need a facility that can cope with that kind of challenge because we have the manpower to manage them. Our histopathology. Even though our molecular lab is new, our histopathology unit is old. In a world where cancer services is becoming very important, we need to have a robust histopathology unit. Facelift. Let me just be kind enough to say facelift. If I say renovation, it would sound facelift. Facelift. Please, Honorable Minister, we are asking for your help in that regard. Staff quarters. Honorable Minister of State for Health, sir. This is Lagos. In Lagos, accommodation is not cheap. The average person that works in this institution lives outside the outskirts of this locality. Ikorodu, Owoeye, really far. And currently, transportation has become challenging. If we can have a place where they can be domiciled from Monday to Friday, and then they go home on weekend, no matter how small the place is, I'm sure quite a number of them would appreciate it. Not only that, the hospital has some flats that were purchased from Lagos State at Oba. Lagos State has taken one of those buildings. Lagos State has refused to service those buildings. Those buildings are not in a very nice state, if I dare say. I know you have a relationship with the Lagos State governor, and I know that the current Lagos State governor was the managing director of LSDPC. So he has a link to all those buildings because those flats were sold to us by LSDPC. We would appreciate renovation, touch up, making it more habitable for our staff. And if they have more, they can give us. We are providing services to Lagosians. And we are providing services to a lot of Lagosians. If they contribute towards the welfare of members of staff, it will be appreciated, Honorable Minister. Honorable Minister, yesterday you said part of your mandate is to see to it that you unlock the potential in the health sector such that we can provide more robust services. To that end, this institution will do well with a modern surgical skill center. We don't have one. And I know that by virtue of your experience and exposure, you have a good idea of what I'm talking about. Staffing. Honorable Minister of State for Health, sir, we are short of 310 staff. The bulk of them are in the nursing department, amongst doctors, amongst physiotherapists, pharmacists, laboratory scientists, core health service workers. We didn't sit and watch. We submitted our application for a waiver to the head of service around February, March, early this year. As at date, we are still struggling for our waiver to be released. We are still struggling for it to be released. And the waiver is not released. There is no way we can even get to budget office for authorization. There is no way we can go to federal character for assessment. So right now, we are short-staffed and people are still leaving because of circumstances that are beyond their control. So we are appealing that our waivers be released quickly before it becomes a situation where people will be, when we start suffering a negative feedback and people will start running because they are being overworked. We are also hoping that the 1-for-1 replacement, after our waiver has been released and we have requested our 310, then they can give us the 1-for-1 replacement so that for every person that goes, we are authorized to replace with one of like, a nurse for a nurse, a pharmacist for a pharmacist, a doctor for a doctor, physiotherapist for a physiotherapist. Energy. I know that wherever you go on this your trip, energy is going to be what everybody will say. So permit me to say what you already know. We pay 17 to 22 million naira monthly to the Kenya distribution company. The hospital has 9 generators. And the maintenance cost of those 9 generators is about 2 to 5 million naira monthly. The hospital consumes diesel of between 7 and 17, where 7 is where we have 4 to 5 hours of power failure in a month. And those power failures come on weekends where there are no activities. For every 40 hours of power failure that we have, we consume 5,000 to 7,000 liters of diesel. At a current price, the diesel price is over 1,000 naira. There's no way overhead can keep it up. And when you are the board chairman, honorable minister, you mandated us that the hospital must be lit at night. So we are appealing to you. Currently, we are solarizing. We have solar panels on the casualty. We have solar panels in the lab. The solar panels for the A, B, and D wards are already in the hospital, about to be installed, so that at least patients can have light and fan in the evenings. We have attempted gas plants, but none of them has come to fruition. So we are just contributing our own to what I know you have heard, and you still hear more as you go on this official visit.
Dr. Alausa, in his response, assured that the ministry will look into all requests diligently. He assured that the country will get better with the renewed hope of President Bola Ahmed Tinubu. Believing Nigeria is on the path of production economy.
We recognize the chairman of SEMA, Dr. Lawal, his predecessor, Dr. Igbobi. Thank you for everything you're doing for this great institution. The top medical members of the top medical TMC, the new director of finance. I'm not sure if you're still new. I can't recall at the exact time Mrs. Yusuf retired. Then Mr. Folari, who I don't know if it was deliberate by the MD. Mr. Folari has lent the job. He would always be at the board meeting, coordinating every single thing we did there. Congratulations on your, is it acting or full? I'll still congratulate you. Yes. The head of the department here present, our members of the leadership of the union, thank you. There's been peace lately, and the peace we're experiencing in the healthcare sector today, it's not just by coincidence. It's proactive. It's due to proactive engagement of what myself and Honorable Mr. Pate have been doing in the health sector. We've reached out to the union, to the MDCAN, the National Association of National Resident Doctors, and all other unions. And because we're here to listen and to take care of, to be responsive to your needs, logical needs, not illogical needs. And then the union, you've been very logical with us, would address a lot of the things that are of huge priorities to the hospital. Now, I said I'll come back to Dr. Alimi. This hospital is very lucky to have a medical director in the person of Dr. Alimi. When I was appointed as the chairman of the board about 6, 7, 8 years ago, the first person I met was Dr. Alimi. We had a meeting. He came and met me at my residence in on the island. So once they said, Chairman, I did my residency in this hospital, and I started working in this hospital. This is the only place I've worked in my life. And at that point, I said, I counted myself lucky as chairman then, because I knew my job would be easy. So, and since then, every single thing is passion for this hospital. It's passion for patients. It's passion for welfare of staff. It's second to none. And I'll tell you, this is a fact now. Since I've assumed this position as the Minister of State for Health and Social Welfare, I've had to talk to several CMDs, several medical directors of the Federal Medical Hospitals and Specialist Hospitals. There's one incontrovertible fact, which is unequivocal. Federal hospitals have been the one that have saved our healthcare delivery system in the country today. So, every member here, you contribute to that. You're a contributor to that. Beyond all the things that is happening, this is a bright spot in our healthcare system. Our federal tertiary hospitals are doing well, and we will support them to continue to do well. And more so, Igbobi, National Orthopedic Hospital Igbobi has been distinctive in the kind of care and services they're providing to the millions of population in Lagos State. Because though you're not caring for millions, but millions of people have opportunity to access the care. The MD, Dr. Alimi, was not bragging when he said the diagnostic center you have here is probably one of the best in the country. It's not bragging. It's not something that is bragging about. That's your state. And the amenity ward as well, I've been around to other hospitals. You have one of the best amenity ward in the country as well. Also, all the infrastructural upgrades that have been done in this hospital in the last 5-6 years since Dr. Alimi assumed the mantle leadership as the medical director, it's just been on and on and on and on. So it speaks to his leadership skill, to his temerity, to his integrity. And initially, there were gray areas that he complained to me that he did not like, the way things were being done, the way we're collecting money manually. He was the one that brought it up to me and said, Mr. Chairman, we have to move this into a digital platform. Collection of funds in all areas of the hospital, I do not like it. You know, if it was somebody that wanted to encourage underhandling, he would never have brought that up. And I said, we will do everything to support you, and I gave him as the chairman, as the medical director, let's migrate all our payment system onto digital platform within 2 months or 3 months. But then I'll tell you, it was done ahead of schedule, ahead of the target. So let's give him a huge commendation for that, which I know other people in your finance department work with you. Now, thank you for everything you're doing and everything you will continue to do to this hospital. But I'll tell you, it's like this is homecoming for me. And when you get to your house, when your family members, your kids ask you for, this is what I want, this is what I want, it's your responsibility. So all your needs are my responsibility. And we'll do everything, we'll work patiently, but we'll get there. With all the things you've asked, I'm going to be a bit specific. We might not get it done in the next 6 months, but I promise you, we'll try and get everything accomplished. I also need to commend everyone from the MD to every member of staff that has actually worked behind the scene to see to the fruition of the opening of the School of Nursing. So let me just thank you to you, because you had the School of Post-Basic Nursing here, which was functioning well, but the way things are now, the problem we have about human resource for health, it's not only in the country, it's a worldwide problem. Today, the last estimate that came out, there was about 18 million human resource for health deficit around the world. But unfortunately for us in Nigeria, people in America will not live, healthcare providers in America will not live to come to Nigeria to work. They won't live to go to England to work. But it's a free world. Everybody makes decisions based on what they need. People are living here to go to other countries to work. So I know this country is going to get better. I know it will get better. But it's not what the President Bola Ahmed Tinubu, his passion, his conviction, his dedication, his hard work to fixing this country. And he says it. And when President Bola Ahmed Tinubu says anything, he means it. He never makes empty promises. He said, I will fix this country. And it's gone beyond saying, I will fix this country, to this country will get better in the next 7 months. Things will get better. It might be a little bit hard, and in life, they're saying what will get better will be hard initially. But the fundamentals that we need for this country to get better, President Bola Ahmed Tinubu has taken the hard decision already. Decisions that previous president, head of state, could not have taken in the last 40 years. He came in, he's done it. So things will get better. I said that because even people that went out, I don't have any doubt they'll start coming back. But before they start coming back, what do? We still have a problem here. We have to fix this problem of human resource for health. And the way to fix it for now is to produce more. And that's what we're doing. I've had meeting with the registrar of the Medical and Dental Council of Nigeria. And now we're going to double the enrollment into our medical school from 5,000 to 10,000 in the next academic year. That will happen. I just had a meeting with the registrar of the Nursing and Midwifery Council. He's a good man. He's done well. He's increased the number of students graduating every year in nursing from 16,000 in the last 2 to 3 years to about 23,000. But everybody here will agree with me that 23,000, a country with 230 million people graduating 23,000 nurses a year, we're still running a huge deficit. So I've mandated him that we need to increase our graduation rate to almost 100,000 in the next few years of nurses. General nursing to their programs. And I said, I've gone around, I started by thanking everybody here, Igbobi, and I'm so delighted that when the registrar was reporting to me, he said the only hospital that has started School of Post-Basic Nursing, so that has added General Hospital to their School of Post-Basic Nursing program is the National Orthopedic Hospital Igbobi. Thank you for that. The ND followed through to what we planned. This was a conversation at the board meeting a few years ago. You're leading it now for this great platform. For us, there are almost 60 School of Post-Basic Nursing around the country. If we're able to, even just, for instance, the infrastructure is there, everything is there, you had 100 nurses more per year to those schools. 60, that's around almost 6,000 nurses additional with opportunity. And I said that I was very intrigued with your numbers that you quoted, Dr. Alimi, for 50 slots. 1,960 people have bought the forms, You had exam for 1,772 people. You only have a slot for 50 people. That's an acceptance rate of less than 5%. What? Less than 5%. You know, we have to be responsible for our youth, for our younger population. These kids we should make them feel unfortunate because they're born in a country in Nigeria that is great. We should do everything to harness and open up opportunities for them. Figure out if we're able to expand the space here, people want to go to school. They want to do a problem. It's not that our kids do not want to go to healthcare sector. They want to go there, but the opportunities are not being given to them. And this is one of the major parts of our priority in this government. We will unlock the potential in our system. So Dr. Alibi, I'm going to talk to the registrar to increase the quota. And they're working on the ratio, and the quota will be increased in a lot of other areas. Obviously, you have demand, because they also have to have, we've spoken about nursing hostel and things like that. I'll get to that. So that, with all the things you've asked for, I've made notes here, and I'll just quickly go for the benefit of everybody, since you've made it public, so I'll let everybody. So with all the impact, we will work on that. And as you were talking, I feel bad that in 40 weeks we would have spent 40 million. So I'll coincide with you. I have some other ideas to provide some palliation to that. I don't know if it will work, but we'll talk about it during that talk. The bone center, the histopathology lab, and the surgical skills center. Those ones we can work on two strategies here, which you probably have to come to Abuja for a side meeting, but I'll let you can work on creating intervention fund that will approach the Federal Ministry of Health to see what they can do. We'll bundle it together, and then we can also work through the SDG to see what they do. Because we develop intense partnership with them. Like everybody knows, healthcare is the third SDG goal. And the current senior special assistant to the president on SDG affairs from Lagos, and she's promised that she'll be spending a lot more money on the healthcare sector now. So, and we've had meetings actually with your solar, with your energy. She's given us commitment that she would support building renewable energy centers for some of our hospitals. We will hand Igbobi to one of the hospitals. With regards to the accident and emergency building and the general patient building, I feel sad that 5 years after, it's not been completed, but we'll discuss strategy to complete those buildings. Now, with the waiver, let me talk about the remittance first. I don't know where you got the 40%. The standard percentage is 25%. Oh, please, let me get those news. Yes. Oh, there's a news. 40% of what? It should be 40% of your net in whatever you make at the hospital. They cannot charge 40% of implant. You're not a trader. They can't turn you into business. But this civil servant, the government needs money, but then the healthcare sector is very peculiar. We just have to explain to them. There are a lot of good people there. So they can't tell you to charge 40% of it. You're not set up to make margin for government on implants, on what you do. It should be 40% of whatever, once we've taken all the cost out, and then what's left. But we will go and explain to them. And luckily, the Accountant General report to the Honorable Minister for Finance and Economic Planning, Honorable Mr. Wale, who is also very pro the healthcare sector. Everything we asked him to do, it's done. It's done. So I will take it up with him. Dr. Ajuwo, please add it to one of the with regards to the waiver, and the waiver, don't worry, that will be taken care. And I'm very surprised that you said you submitted your waiver in February and March of this year. Did you submit it to the Ministry of Health, or okay? We already have a plan for that. That and this one-on-one replacement. You should not, and I don't want everybody to have this wishful thought. I pulled the head of service, Dr. Folashade Eson, who also happens to be a physician, a doctor that worked in the healthcare sector. She understands our need. I pulled her aside at one of our meetings and I said, listen, this one-for-one should not be difficult. Why is it taking this long to do? And then she took her time to explain to me. I think there's huge miscommunication here with this one-for-one. She said, we're giving the hospital enough fund. It might be enough in our eyes, but significant amount of funds is still not enough, but significant amount as non-regular. And the plan is for them to use this fund to hire people, staff, nurses, medical laboratory scientists, and any of the other workers, pharmacists, doctors. Hire them as local. Wait for your waiver. Once you get your waiver, move them in to those stores. So that's the way. And they said, once that's being done, there should not be any need for one for one. And honestly, after listening to her, I thought it was a very practicable way. But the thing now that what I've seen and what I've taken back to her, this non-regular is not dedicated alone for this replacement. They've added interns on it, they've added house officer salary in it, and so they just have to find a way to have a more better upgrading in the way they calculate. Because you see an hospital like you're non-regular, you're serving a huge population, you have a less amount of non-regular compared to another hospital that has a lesser number of patients. So that has to be more. The non-regular has to be done in a more scientific fashion. So I'll meet with that and probably with people at the Accountant General office to see what we can do about that. It's not only a problem here, it's a problem across our hospital. So, but let me say once again, I'm very happy to be back home, and nobody can feel the joy that I feel today. This is excellent care that each and every one that works in this hospital continue to provide to our patients. The patient in this current administration, the President Bola Ahmed Tinubu has mandated us, myself and Dr. Pate, we have to work to provide the best care to each and every citizen of this country. And we do not have a choice, we will do that. And thank you, everybody.
Please appreciate the minister once again.
Right now, the ability to run the training program for patient center care. There's an NGO. Mabo. So this is structure right engineering company. Honorable Minister of State for Health and Social Welfare. So briefly about this building, what you guys found there, what you're doing.
Yeah, the result on the okay. Let me start from the structural part of the work.
Yeah.
So we have some failures on the columns. So we are trying to straighten the columns now.
All the columns are some
No, parts.
part of it. Okay. About how many columns are
55.
So how many do you have failures on?
No, we have like 70 or 100 columns. We are doing like 55 columns.
Oh, 55 at top.
So 55% failure.
Yes. On the ground floor alone?
On the ground floor alone.
But you think once you
we are straightening now.
Okay, yes. So that would give the stability.
Yeah. What about upstairs?
Officer, the same thing is applicable to house.
Okay, the same thing.
Yes. What is the state of that roof now? It needs total repairs.
Yeah, okay.
Yes, sir.
Yeah.
It's just finished momentous. That's it. Plumbing, Mr. Owoeye? No fittings at all. The electrical zero. So all we just did was that, okay, at least we thought we could finish it so downstairs, let's do the electrical. Open. Big guys, you close. No, sir. I'm in touch with ministers.
That'd be
No, it will be enough. I like it. Yeah, these are ground floor, level 1.
oh, consider
So plumbing never say anything about this drain. To see pipe with
relay can be rolled out quickly.
Because they are students with very we got somebody who is really good and does the maintenance.
Okay,
These are
Okay, so we're doing quality improvement.
take a seat, take a seat.
So it's quality improvement training that we're doing here. We know that structure is not the only thing about the hospital. We need to work on our staff. So we do things around empathy, communication skills, and all the core competencies that we believe can improve care delivery, especially in amenity wards. And that's what we're doing here today. We have a lot of interactions, discuss a lot of issues, and then that's what we're doing. Now we're doing empathy actually.
So you have been training, so we can know for us, how did you develop this?
Dr. Owoeye also is recently trained into emergency care service. So he also trains basic life support training for our doctors and nurses. So he does this training all over. So he's a friend of mine.
Okay.
Come and do this for us.
Come on, okay.
Because we've seen him doing it elsewhere.
Okay.
I'm also a medical educator in the UK, so I'm a fellow of in the UK.
Okay.
I just came back home, and I know people are just...
Introduce the minister to your machines, please. Yes, washing the machine. And it's a washer itself. So after washing, you can start it. And directly from here, you can take to your dryer.
How long does it take to wash?
After the 40 minutes of washing, This was within less than 5-10 minutes. The first panel the entire campus. Now, these are the two sources. The first and the second one. Right? These light indications show that we have power available. So when one is off, switch over to the other. Now these are the three that going to our substations. In the premises we have 4 substations. One is at so each of them.
So this building, College of
We're hoping that when the students
what exam is this?
IV blind, intubation, and how to do IV and everything. So they do exams.
They do.
So this is really one student.
Your hospital should be a training ground for practicals. So that when they attend their online lectures, when they want to do practicals, they come here, they will stay.
Okay, this is actually the third day of my official tour of Federal Tertiary Teaching Hospitals in Lagos. As you've all followed me in the last few days, this is almost the last stop, but I'll still be visiting the Neuropsychiatric Hospital, the Annex in Oshodi, to conclude my first official tour for the country, starting from Lagos. We will be visiting several other states in the next several weeks to months. Now, to answer your question directly about what to expect, before we get to what to expect, let's look at what's on the ground. As I've said multiple times, that federal hospitals, federal tertiary hospitals they've been the hospital that have really saved and rescued our healthcare system in this country. Several of these hospitals they have facilities that you can compare to anywhere in the Western world, and the kind of services they're providing is exceptional care to a patient at a really discounted care. Federal government is funding these hospitals very well, though a lot of the hospitals will still ask for more, but they are adequately funded now. But as part of the leadership in the Ministry of Health now, myself and Honorable Mr. Pate, we're committed to significantly to continue to fund this teaching hospital.
A dream does not become a reality through magic. It takes sweat, determination, and hard work. Without doubt, the Honorable Minister of State, Health and Social Welfare, Dr. Tunji Alausa, has dedicated extensive sweat, determination, and hard work during his visit to various medical facilities in Lagos over the past 2 days. His commitment has enabled him to gain profound insight into the state of these facilities and offered practical solutions to address many of their challenges, providing also valuable guidance for the continuous advancement and optimal performance of the health sector. We applaud the Honorable Minister of State, Health and Social Welfare, Dr. Ali Pate and Dr. Tunji Alausa, for their visionary efforts, and we eagerly anticipate the realization of the healthcare sector vision. Until next time, this is Comfort Olayinka reporting for a Cohort blog.